Hey everyone, Dr. Hanisha here. Thank you so much for joining me on my podcast, Mahan Health with Dr. Hanisha. Mahan literally translates to great in Sanskrit, and it only makes sense to have the absolute best when it comes to your health. My goal is by you listening or watching this podcast, you're getting just a little bit closer to achieving Mahan or great health yourself. This podcast is all for you, so please make sure to comment what you'd like to learn more about so I can get a guest on the show who's an expert in that field, or I might even talk about it myself. However, before I move on with this episode, I'd definitely like to address what is going on in the world right now. This is a difficult time for many of us with the coronavirus pandemic. During this time, I humbly ask that you be responsible and conscious of the decisions you make, as these decisions can impact the masses. Please make sure to clean more often than usual, social distance yourself, and avoid travel as much as possible. But also ensure to take care of your mental health and manage your stress in a healthy way. A good way to do this is by looking for the silver linings. This time can be used to look inward, to reflect, to walk in nature, to cook more, to spend more time with family, to finish that painting that you finally want to finish, or do whatever it is that fuels you. For me personally, meditation, cooking, and nature walks have been super helpful in maintaining peace and calm in my life. With that said, I am still seeing patients and clients virtually with my practice, Mahan Health. You can book your free 15-minute phone call today via the website in the show notes. I'm here for you 100% during this time. If you're feeling more stressed right now, please just reach out. Whether we set up an appointment or not, doesn't matter. Just reach out. I'm here to support you during this time of hardship. And I promise you we will come out of this and we will come out stronger. All right, getting into the episode. Today's episode, I had the opportunity to interview a friend and esteemed colleague of mine, Dr. Morgan MacDermott. Dr. Morgan MacDermott is an expert in women's reproductive health dedicated to transforming the struggles of the modern mother. As a licensed naturopathic doctor and the mother of 2 young children, she blends medical expertise and gathered communal wisdom to help women in person and online, I'm assuming more so online right now, to navigate wellness throughout this revered metamorphosis. Although she felt very prepared for motherhood the first go-around, she felt gut-punched by the universe with her postpartum issues of recurrent mastitis and postpartum anxiety. These experiences helped her immensely, not only in how she would go on to create an entirely different postpartum experience for her second child, but also with the women she works with as patients in her private practice. Morgan believes that the best way to advance the health of future generations is by revolutionizing the health and well-being of our current mothers, and she is a powerful voice for natural medicine in the fields of preconception, fertility, pregnancy, and postpartum. Dr. MacDermott is such a fun and vibrant being, and I'm so excited for you all to listen to this episode because she's so passionate, and I always remember her obsession with preconception, conception, pregnancy, postpartum, babies, and all of the things that entail the creation of life. And I love seeing this passion in her, and I think you will too. So please make sure to leave comments on what you thought of this episode and reach out to Dr. MacDermott or myself after the show. All right, enjoy. Hi, Dr. MacDermott. Thank you so much for coming on the show. How are you doing today?
Thank you so much for having me. I am great. I'm fully rested on a good night's sleep, and I had a big breakfast, so I'm ready to go.
Awesome. I love it. Love to hear it. So just getting right into it then, I ask all of my guests on the show this question because I feel like our stories are what define us, and they're the reason we are who we are. So tell us a little bit about your journey. Tell us what brought you to naturopathic medicine.
Okay, so I was the really nerdy little girl that loved science and loved animals my entire life, and I always wanted to be a veterinarian. Up until when I was a sophomore in college, I wanted to be a veterinarian. So I did all of the prep for that my entire life. I was so into animals. I was so into biology and physiology and medicine. I worked in a hospital in high school as like the room service for food, and so that experience really turned me off to human medicine, honestly. I was like, I don't really want to do this. And my mom is a labor and delivery nurse. So I grew up in the conventional medical world, and I had a lot of experience with it. And I just had no interest in working with people at all. I loved animals. And then in high school, I started to get into health, and I kind of became the person of my friend group that, would know more about vitamins and nutrition. And I remember acai berry, was all over Costco, and it was like this antioxidant like thing, it was like 2007, 8, whatever it was. And it was really interesting to me on like the human health aspect of things. But again, I didn't know anything about naturopathic medicine at that time. And so fast forward into college, I was on my computer and an ad for Bastyr popped up. I'd never heard about naturopathic doctors or naturopathic medicine at all. And I was like, what is this all about? Because I was really interested in the natural side of human medicine, but I just didn't know that it existed. I didn't know what I could do in that field. So I was like, I'll just work with animals. Mm-hmm. And so then when I started to look into that and then shadow a couple of doctors in the city where I was going to college, I was like, yes, this is it. And so I changed my minor my major just a little bit, where the concentration flipped from like an animal model to a human physiology and anatomy and physiology model. And that was kind of it. And then I finished college and applied to Bastyr, and then here we are. Now I'm a doctor.
Yes, that's awesome. That's a great story. I love it. So what got you into more of the pregnancy, motherhood side of things before we get to the real deep questions?
Yeah, I think I'm really unique in this way that, and I don't know why, cause, my mom was a labor and delivery nurse, but she didn't come home talking about births all the time. And she really, she quit doing the classic L&D work maybe when I was like 10, 11, 12, somewhere in there. And then she was working in an outpatient like women's health clinic. And then she just kind of bounced around. She gets bored pretty easily with, she wants to keep learning. And so she's been multiple different kinds of nurse. So I would say that
far from the tree.
So yeah, I know. Sometimes I'm like, why do I want to do all the things? And I'm like, oh, because my mom does. That's why.
Yeah.
And so in my more formative years, I would say of like, junior high and high school, she wasn't even doing births. And so it's interesting because I remember very clearly by the time I was like 16, 17, I knew I wanted to have a home birth. And I couldn't wait to be pregnant. I absolutely had no interest in being a mom at that time. I was like, I do not want the baby, but I just want to experience pregnancy. It was so fascinating to me. When I was little, when I was obsessed with animals, like I was telling you, I bred animals. So I bred hamsters and I bred fish, which was really weird. So I was always interested in that process, and I couldn't wait to experience it myself. I just knew I didn't want to do it at that moment. And then when I decided to shift my major, and in my college experience, I became a nanny to make some extra money on the side of things. And I loved the kids so much. But it's funny because I was never like the babysitter when I was younger. I didn't like babysitting kids. But once I got into college, it's like the maternal clock kind of turned on, and it was like, I loved kids, I loved babies, and I loved pregnancy and all of it. And so basically from day one, once I started naturopathic medical school, I knew that working with women's health and pregnancy and fertility were going to be my thing. And then when I had my son in my third year of school, that's what really got me into postpartum, because like the postpartum period and working with women's health and mothers more specifically. I do love fertility and preconception and the pregnancy aspect of things. But I think my biggest of those, that kind of spectrum, my biggest passion lies in the postpartum time and mother's health, because it's just really, really hard sometimes, and it's fascinating and challenging, and I thought that I was so prepared, and I was not. So
yeah, definitely. Yeah. So well, that leads right into it. So what is that postpartum period? What does that really mean?
Yeah, okay. So the postpartum period is kind of more broadly defined as the first 12 months after a woman has had a baby. And then in some fields, they'll say that it's mostly like the first 6 weeks, because that's like when a lot of changes are happening. Within the first couple of days postpartum, there's so many changes happening in the woman's body, and she's more at risk for things like hemorrhage and preeclampsia and the uterus not contracting back down and all those sorts of different things. And then through the first 6 weeks, there's still a lot of changes happening with like the blood. So the blood volume increases dramatically in pregnancy. And so all of those cardiovascular changes are kind of going back to the pre-pregnancy state. And so there's a lot happening in that first 6 weeks. And then through the first 3 months, it's like, through the first 6 months, those changes start to gradually slow down. But some people would say the postpartum is forever because you're always mother and your body is always changed, you know. There is sometimes though the word, oh, go ahead.
I was just saying, it's never going back. You can't go back to before you ever had a child.
Right. And honestly, this is a really interesting point of discussion because there is a lot of pressure to get your postpartum or your pre-pregnancy body back and all these sorts of things. And although, yes, maybe like on the outside you can, you know, regain fitness to a certain level and look like you never had a baby, but your body is always going to be different. And that's beautiful. And it shouldn't be something that we're, you know, sad about, or I can understand, you know, stretch marks. Some women feel them, they are beautiful, and some women are upset that they have them and they are a more permanent thing. And, you know, that's like one thing, but there's just this whole energy around what does that mean that you created a new human in your body? And yes, there's going to be marks on your body from this, and we can't expect it to be the same. And if it was the same, that would be kind of weird, wouldn't it? To like go through this radical change and process with no external marker that it occurred, you know? But I did just want to say really quickly to clarify, because sometimes when people use the word postpartum, they are actually referring to postpartum depression. They'll say like, I got postpartum. And what they mean is postpartum depression, or sometimes another postpartum mental health issue. So there's 5, maybe 6 main mental health issues. There's postpartum depression, postpartum anxiety, postpartum OCD, postpartum bipolar disorder, postpartum PTSD, and then postpartum psychosis. So those are like the more well-defined. Obviously, there's lots of gray areas in there. But postpartum depression is the most well-known, and unfortunately, it affects, they say on the low end, 10%, up to like 25%, but then there's some other sources that are saying it's maybe 50-60% of women are experiencing postpartum depression on some level, and maybe that lower bracket is women experiencing it to a more moderate or severe level. So that's concerning to me as a marker of our general health in society and where we're putting our priorities of, you know, caring for mothers or not. So that's kind of my life work.
Yeah, definitely. I love it. Okay, so what are some, speaking of then like that modern time, what we're dealing with, what would you say are some of the unique challenges that the modern mother experiences that maybe our primal ancestors did not go through?
Yeah, so this is really interesting because I don't know if it's just, there's kind of like a cognitive dissonance. People are reverting now in the last like 10, 20 years. Our breastfeeding is becoming more popular again. And because, you know, the age, like when you and I were born, the 80s was a very pro formula time period. And it's coming back where people are working on breastfeeding a little bit more than they maybe had been. And there's this attachment parenting, kind of this like movement around, you know, organic and health, and all in society, everything in society is becoming a little bit more like, oh, hey, actually, you know, all of these lifestyle things that we do, it really matters. And in the motherhood sector, the baby sector, the same thing is happening. And at the same time, when those kinds of behaviors are implemented, so like breastfeeding and co-sleeping and, you know, baby wearing and being around your babies a lot of the time, like that, the time dedication to that and effort is immense. You know, it is easier to give a bottle sometimes, or put your babies in daycare, or have them sleep in a separate room and cry it out early on. And, you know, it is easier for our structure of our day because, and it's not anybody's fault, and it's not anybody choosing to do anything incorrectly for their child. It's that our society is not set up for us to take the year off from work that it would really require that other countries give their women, is these big long maternity leaves, because it is such a huge energetic and time demand to raise a baby. And it's also this like beautiful, amazing time in your life that you want to be with that baby as well. But we don't have the community support. We don't live in villages like we used to. We live in our little nuclear segregated family units with our white picket fences, and everybody's in their house just reinventing the wheel again and again and again, without much of that, like, you know, the aunts and the grandmothers and the sisters all giving their input and offering help and support in that way. We have to go seek it in an external fashion, or hire out support, you know, lactation consultants and doulas and all these different things, which I'm so grateful we have. but that all of that wisdom was built into the structure that we evolved with. And so to be doing something so important for the health of our future generations, like raising a baby in the first year, without any of that support is just, it's kind of wonk. It's wacky. It's crazy that we're doing it.
No, it's crazy. It's absolutely crazy. And I commend any woman who goes through that, because like you said, we're just lacking so much support. We're not as tribal anymore. We're not within our communities. And on top of that, like kind of, I think you touched on this a little bit. There's a lot of shame of mothers, like, and I think it's absolutely ridiculous. There's so much shame of like, oh, they're not doing this one thing right, or they're not doing this thing right, or like, and constant judgment and shame. And and no mother is doing it wrong, right? Like I feel like that doesn't even make sense. Like everyone is doing their best for their child, and whatever that is, that's what it's going to be. And I feel like we need to start pushing away from that shame. And I really appreciate all that you do to help limit that, or
thank you.
Yeah.
Well, and that's another aspect of this modern motherhood issue is media, social media, the unrealistic expectations that I think some people can, they're not trying to necessarily hurt anybody's feelings when they post pictures of their bodies looking completely normal 3 or 4 days after they had a baby. But what it does in the minds of the vast majority of people whose bodies don't look like that after they've had a baby is it's like this pressure, this level of expectation that's unrealistic. I had the expectation going into motherhood that because I knew so much on the medical side, because I was in naturopathic medical school, and because I had several friends who were mothers and I had really witnessed their whole journey, that I was going to have an easy time. It was going to be like a hop, skip in my step, and then my life was going to continue on like normal. I was going to finish medical school with a newborn, and it wasn't going to be a big deal. Like, I don't know. I just didn't understand. And you really can't. You can try to prepare people, right? And they just don't really totally understand until you're in it, just like with any experience. But the idea that I had that was going to just not be a big deal, being in medical school is a perfect microcosm to the macrocosm of like the dysfunction of our society, that people are not, not sharing with each other what it's really like, and that is so helpful. Like, why would we not share what it's really like, as if it's like shameful to us that I'm having a hard day or something? People, and now you can see this on Instagram, social media. People are actually starting to become more transparent and be like, hey, this is what it's like for me, and that's really helpful. Because this is a huge character shift and character role shift in your life. If I thought that my pre-pregnant Morgan was going to be the same in my mental, emotional, my soul, my spirit, my everything was going to be the same now that I've had a baby, I mean, it's just like, it's ignorance, really. I was just ignorant to the experience. I didn't know. And I think to come to expect that, they're in some, I don't know like what the field is, but it's called the transition between the maiden and the mother. So the maiden is the woman before she's had children, and a mother is the woman after she's had children. She's always a mother. Your soul is different. Your brain is different. We know this. On MRI, the gray matter, white matter ratio is different. It's always different. It's permanent. And it's evolutionarily protective so that we drop into that yin, like more feminine energy space, feminine, not gender feminine, but feminine, like yin yang, masculine, feminine, of that, the flow state, the flexibility, the grounded, calm, stable ground through which our children can bounce off and learn and have this, this person who's like kind of in this chill state, which I was not. I was in medical school. I'm still not really a chill person. And so it was even harder, I think, in that.
Still amazed that you did that, by the way. And then all the other women throughout medical school who, how many babies were there born? They're almost 30.
In the time span that we were in school, so the 4 or 5 years that we were in school, Bastyr, San Diego pumped out like 35 kids. Yes. And that is not that many adults, because each class was like 50 students.
Yes.
Yeah, so that's kind of crazy.
Yeah, crazy.
Yeah.
But, okay, so moving right along. So you did talk about some of the postpartum mental health conditions, but what are some other common conditions that can arise after or during that postpartum period?
Okay, so there's the more immediate ones, like the recovery from the birth. So if you had a vaginal tear, if you had a cesarean section, it's major abdominal surgery. Yes, it's the birth of a baby. and it's major abdominal surgery. And so that's like a double whammy difficult, because now you have to recover from this, which normally if you didn't have a child, you would be laying in bed all day, you would be doted on, pampered, and now you have a newborn. So that's very challenging. You know, and then there's the common things like soreness and fatigue and the sleep deprivation. You can have a hemorrhage, so blood loss, which leads to anemia. I know that these are kind of all sound negative and scary, but like, I just think like talking about it though, and having people be like, yeah, you go, whoa, this is a really big deal. And it's likely to be fine. It's most likely going to be okay. Otherwise we wouldn't all be here. Right. But I think knowledge is power. So I'd like to share all of the nitty gritty stuff. So, preeclampsia is very, very rare postpartum. It can happen though. And it's that combination of protein in the urine and high blood pressure. And, you know, it can show itself with raging headaches and abdominal pain, and it can lead to something called eclampsia, which can cause seizures. So that's, you know, something you want to be aware of, that if you're having this constellation of symptoms, that maybe you contact your doctor again. Then there's the care of the baby. So breastfeeding issues, there's mastitis and clogged ducts, cracked, sore, bleeding nipples, a baby that won't latch. You know, that's another thing, is that breastfeeding is natural, and a woman has to learn how to breastfeed by breastfeeding. A baby has to learn how to breastfeed by breastfeeding. They come out with like certain instincts. They really want to suck, and they can kind of see the nipple and they find it, but that's about it. And we don't come out with like that many instincts, except like sit here and like feed this baby, and the instinctual drive to keep the baby alive and to do anything for the baby is very strong. But man, I mean, if you go your entire life living in America and never seeing a woman breastfeed because everybody covers themselves up or is shamed for it and doesn't do it in public or whatever, and then you're expected to breastfeed your baby 10 to 12 hours per day, which is what it is, you can't like outsmart that system. That's how much time it takes initially in your day. It's craziness that we expect women to have no issues with that when they've never seen it and they've never done it themselves. It's crazy.
That is crazy. I think that's a really good point too, that the fact that we just never seen it. I actually was talking to a friend who said, you know, she's 28, 29 years old, and she's like, I've never seen a pregnancy before. And she was talking to her friend about it, and they were both really nervous, and they were scared to watch it. And I was like, this is something that most women.
Do you mean a birth?
Yeah.
Oh, birth. Okay, I thought you said pregnancy. Yeah, a birth. No, I know. Isn't that crazy? Okay, yeah. This is like a huge point of passion for me, because it's a similar thing where how do you expect in the conventional birth model of the hospital system, it's going to be, usually if it's a heterosexual couple, it's a man and a woman. The man has no idea anything about birth. The woman's never given birth before if this is her first time. And yes, there's nurses that come in and out. But for those two people who've never experienced this gigantic, huge, insane thing to happen, and for it to like just be fine and have no complications, or to like, you know, not feel kind of traumatic in how intense and difficult it is just silly. Like, we're really setting ourselves up for failure in so many ways with that model. It's like, and you know, now there's these studies that are coming out about doulas. Doulas are just labor support people. A lot of people kind of get confused about what is a doula, what is a midwife. So the midwife is more analogous to a doctor. They can deliver the baby. The doula has no medical training. They just support. So they give physical support and mental, emotional support. They know labor positions and things like that. So there's all these studies that are like, yeah, if you have a doula at your birth, your risk of cesarean or your risk of other birth interventions goes way down. It's like, well, duh. I mean, I'm glad we have the studies to show it. You know, I'm glad that we can now use that. But at the same time, if you think about that logically, of course, because at no point in history have women just like gone off and given birth by themselves. And if they have, which some cultures, that is what they've done. If they have, they've known that for their entire lives. When they were little girls, they knew it's time for me to have a baby, I'm going to go off and I'm going to do this on my own. And they've probably talked to all their friends and all their aunts and all their sisters for their entire lives to hear what was it like, what helped them, what would they have done differently. You know what I mean? It's not like just go do it. Anyway,
right. Yeah.
Obviously, so I get worked up about this.
Thing is to like encouraging our listeners right now to go watch a birth.
Yes.
Get familiar with it with your aunts or cousins or whoever, siblings, whoever having children. Like, get familiar with that process of giving birth, and then also breastfeeding, like you said, because that whole experience is something that it used to be, like you said, it used to be something that everyone just knew. We were all around women who were breastfeeding all the time, and then we just saw someone give birth, like it was just normal.
It was integrated into our life. It's like, yeah, you see other people eating, and that's how we learn how to eat. And you see other people talking, and that's how we learn how to talk. And you don't ever see anybody giving birth or breastfeeding, and you're expected to still do it.
Yeah. Yeah. So I encourage everyone who's listening to definitely, like, even on YouTube,
yeah,
to
YouTube,
promote
and then
your own birth situation. I love watching your birth.
Thank you.
It's on YouTube.
YouTube, and then also going to a lactation support group while you're pregnant, and watching and kind of getting established, find where the lactation support group is, talk to the lactation consultant, find your parking, all those little things that seem really easy. But when you have a newborn in tow, it's just stressful. I promise you, it's just going to make your life easier if you you go, you find where it is, you go to the building, you introduce yourself, you see a couple of women breastfeeding, you hear in the circle what they're talking about, what their issues are, so that you're not surprised and shocked when it's happening to you, if it does. And I don't want it to scare people, because a lot of women don't have any issues, but I would say the majority have some sort of something where they need a little help and support. So, yeah.
Thanks. Okay, so what can we do about a lot of these postpartum issues that you discussed? What can be done before? So I do like the idea of going to lactation consulting groups and things like that. So what else can be done?
Okay, and one last thing that I just wanted to say, another area of dysfunction that can happen, because I don't want the people to listen and be like, well, you never mentioned this huge aspect, which is pelvic floor dysfunctions. So there's prolapse and recovering from your tear if you had a vaginal birth, or episiotomies, which aren't really done in hospitals anymore, thank God. But if it did happen to you, painful sex, pelvic pain, incontinence, so urinary, leaking, or even fecal incontinence. So those are all things that can happen, and pelvic floor physical therapist would be my number one go-to for that. But with the other issues, so in my perfect pregnancy recipe, if I could give it to every woman, would be to understand that this is a time period of dedicating yourself to excellent nutrition, very excellent nutrition. My favorite nutrition book for pregnancy is called Real Food in Pregnancy by Lily Nichols. Nichols is Nichols. And
we'll have everything in the show notes.
Yeah, that's a great idea.
All of the resources that you give, we'll put it all in the show notes so everyone can get access to that. Perfect.
So dedicating yourself to 9-10 months of excellent nutrition, and in an ideal sense that you've maybe been doing that prior to your pregnancy, in an effort of preconception health, taking proper supplements. So my favorites are a good solid prenatal with the B vitamin, a practitioner grade prenatal, vitamin D.
And taking that prenatal after you've given birth as well. I think
continue it. Yeah, so there's this kind of 9-9-9 philosophy. So it's the 9 months prior to pregnancy, the 9 months of pregnancy, the 9 months of postpartum, to continue all of these supplements as if it's just, one big long time period of supplement taking, and, trying not to skip a day if you can, because your body is creating another human body, and that's very, very energetically and nutritionally taxing. And so we want to, here's the thing about it too, is that the baby usually will get what the baby needs at the expense of the mother. So the babies will pull nutrients from bones and from teeth and from the brain, DHA from the brain, into its own little body, which is cool for that baby, but is not cool for the mom. So that's why we take supplements. So a prenatal, a probiotic, a vitamin D3, a fish oil that is high in DHA, and magnesium is also really helpful with muscle cramps and changes, and also with constipation, which is very common in pregnancy. But so I would say it's diet, it's exercise. So this is important, and it's gentle. It's like walking hills, squats, and lunging. That's kind of it. You can lift weights if you want, but really increasing the intra-abdominal pressure more during this time of pregnancy, when there's also this hormone pumping through your body called relaxin, which causes all of your joints and ligaments to be kind of like soft, stretchy rubber bands so that everything can expand. But then what that does as well when you're exercising is it puts you more at risk for injury, puts you more at risk for stretching out those ligaments, which then may not actually tighten and shorten back up because they have low blood supply. So it's just riskier. Doing things like running while pregnant, I don't recommend it personally. I think going on a 30 to 45 minute walk every day, if you can, is like the most amazing thing. Do some squats in your house while you're brushing your teeth, maybe on your walk, sitting in that deep yogic squat kind of position and stretching slowly and really taking this time to consider yourself like a walking garden to nourish and to be gentle and sweet with and to take care of, but slowing it down, not trying to do CrossFit, not trying to run a marathon. Yes, although people want to stay in shape, again, walking is the best because that undulation of the hips like this, and hiking hills, fine, great, go for it. Helps with your uterine position. And when you're getting more and more pregnant, helps keep the baby in the right position. So walking and stairs are like the best things you can do in the third trimester to keep the baby in the right position, encourage them to be head down, all of the things we want so that we can have a vaginal birth in an ideal sense. Another thing is water. So you have to drink way more water than you would think. And then another one is to, when you're preparing for birth, to have a full reverence for this event and not think, oh, I'll just like, deal with it when I get there. I know there's a lot of women that do that and they are still fine. In my mind, I think that it's setting yourself up against, it's like, why be the salmon swimming up the river when you could just like have done some research and plan? And so things like taking a birth class, listening to birth stories from other women. My favorite resource for that is the podcast called The Birth Hour. It's amazing. I love it. Reading books about birth and maybe hiring a doula and making a flexible birth plan. What are the things that you do and do not want? Do you want to be offered pain medication? Do you want to have a home birth? Do you want to have a birth center birth? There's so many options. And I do think it's a really, really good investment of your time and for your health and for your baby's health to think about these things and spend a significant amount of time and then even a good chunk of money on something like a doula, because doulas can run $600 to $1,200. They can also be free. You can get a doula through your hospital. Sometimes they have those, or doulas that are in their training still, and so they need to just get births, and so they're not allowed to charge yet. But that's still so helpful to have somebody else there for support. And then my last little piece here is the making a postpartum plan as well. So a lot of people make a birth plan. They think about the birth, they think about the pregnancy, but they don't really think about what's going to happen postpartum. And I think that's where the magic is, because pregnancy is 9 or 10 months. Birth is a couple of days at maximum. And then this postpartum is like forever and ever. And there's this really unique time of the first 3, 4, 6 months where your body can either thrive and recover, and there's stem cells pumping through your body from that baby, from their umbilical cord, which had gone back into the mother. That is the true thing. There is this energetic and physiological reset that's happening. The immune system is flipping from one phase to the other. Everything is changing, and it can either be a time to repair and heal and then come out of this thriving, or it can be the time to fall into a deep depletion. Adrenal fatigue, autoimmune conditions can present and rear their heads in the postpartum period. Maybe if you'd had like a predisposition, a genetic or environmental predisposition to an autoimmune disease, a lot of the time we find that they're expressing themselves in postpartum. So making a postpartum plan, what I would suggest in that would be something like finding community and support. Who is going to come and take care of you guys? Who's going to come and take care of your dog potentially? Making a meal train. So mealtrain.com is a really great resource. Or if you're going to do it yourself, or maybe, you don't have a ton of people around you that would be bringing you food, to make a bunch of freezer meals and freeze them so that you have food, because something like cooking a meal sounds really simple and it's just not going to happen when you have a newborn, and you need to be eating like 4 meals a day, especially if you're breastfeeding. Really want to just be resting and eating and not leaving your bed for that first, if you can, like 2 weeks. And I know a lot of cultures, they don't allow the mom to get out of the bed for the first 40 days. And that's a true deep recovery. It's hard to do that. You don't feel like you necessarily want to do that for 40 days, but if you do, you are setting yourself up for more success in your energetic and vitality reserves for later. And, then also maybe finding that lactation consultant prior to your pregnancy so that if you have issues, someone to call, those kinds of things, just thinking about it, can I take a full week, 2 weeks to not even leave my bed except to pee, and then beyond that, so sometimes midwives will say 1 week in the bed, 1 week on the bed, 1 week around the bed. So that's kind of like keeping you in your house really close to the bed and relaxing for a full 3 weeks, which again is not 40 days, it's only 21 days, but it's better than what is happening in most American households, which is You'll
Just go.
see a woman at a playground with a 6-day-old or something, and it's like, no, 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 go home, go sit, go rest. So
Yeah.
that's kind of my MO there.
Okay. I had something I was going to say, but I totally blanked. Yeah, no, it's okay. Actually, I just remembered. So before we go into the rapid fire questions, I know a lot of people ask me, and so I'm assuming a lot of the listeners will want to know more about like eating your placenta or Kegel exercises. So I know you talked about the pelvic floor dysfunction. And so what do you think about doing Kegel exercises prior to even getting pregnant to help with that?
So I think that most Americans probably have a hypertonic pelvic floor, meaning too tight, and they don't even realize it. Because if you're doing anything, like if you're a dancer, if you do yoga, if you horseback ride, if you have done any kind of, like Pilates or bar or any of those kinds of exercises for a long period of time, it has trained your body to pull up and in, up and in, up and in, which is cool and great, except that when you're giving birth to a baby, you need to be able to fully relax and go down. So honestly, I don't really suggest Kegels in pregnancy. I think doing things like deep squats that are going to stretch the pelvic floor are going to keep it in a healthier state so that you don't tear. So you decrease your chances of tearing, so that you decrease your chance of having to push so hard, which, because the muscle isn't relaxed, and then later on stressing all those ligaments and tiny muscles, which then increases your chance for prolapse and things like that. So I think having a healthy pelvic floor is, yes, to be able to tighten it and bring it up and in, and to be able to like let it loosey goosey just flow out. That's very hard. And then placenta. Oh, go ahead.
No, go ahead.
Okay, and then, so placenta, unfortunately, there isn't conclusive studies. The biggest study that's been done was in 2016 with 28 women, so 28 placentas, and they were testing it just to find out, are there hormones in this, and what levels of the hormones are there? And they found that there's the same 15 hormones in all of the placentas, and that the levels of estradiol and progesterone suggested that they were at physiological level where they could cause an effect. But the study did not look at, did they cause an effect, and did the women eat them and then have lower rates of postpartum depression? And that was only 28. So it's a very small number. And it's one of those things that we're going to be seeing studies coming out soon, because it's in such a high demand. All we have right now is anecdotal experience with women. And, sometimes they say it was a total game changer. Sometimes they say the way that it's prepared, if it's raw or if it's steamed prior, raw placentas sometimes can cause women to feel a little like too jittery, like almost as if they drank too much coffee. Then there's women who've had the paradoxical effect, and they think that instead of increasing milk supply, like it says that maybe it does, they've found that it had the opposite effect and it affected their milk supply. So it's really like up and down. We don't know. I always like to suggest, though, that there's a couple of other options of ways to honor the placenta as this beautiful organ that helps grow your baby, besides eating it, which you could plant a tree underneath it. You can do something called a lotus birth, where the umbilical cord is still attached to the baby, attached to the placenta, and it's like a very kind of like slow honoring of the umbilical cord drying up on its own and falling off. You could like make a tincture out of a placenta and keep it for when you get your own postpartum periods back. Or I've heard of some women keeping a tincture of their placenta if they've had a daughter and giving it to her, keeping in like the freezer in a high alcohol content and giving it to her when she gets her menses. That's like a really long-term plan of 13, years or so, but it's possible. So the bottom line is we don't know yet.
Okay, great. Well, thank you. So now we're going to go into the rapid fire questions.
Okay.
So the first question, so these are again questions that I ask all of my guests. The first question is, what does Mahan health mean to you?
Okay, so great health to me means having the energy and vitality to do your best work in life, whatever that is for you. Because when we feel crappy, all decisions go out, all of the like maybe harder work decisions go out the door. Harder work meaning to choose to cook your meals at home and to do the right thing, to have the proper communication and boundaries with other people in your life, to take the time to say no and have self-care, and all those things they're just so much more difficult when you're not feeling well. And so especially with like this women's health that I'm in, I view this as having the greatest health so that we can grow the healthiest next generation as possible, and then also have the energy in turn to parent them on this kind of conscious high vibe up level that takes a lot more energy to communicate with them in these ways versus kind of the old tactics that, we grew up with necessarily. And so, and then just not being depleted, rundown mothers in that kind of archetype that is so rampant throughout our society. I want us to be high vibe, vital, life-loving, child-loving mothers that are not, resentful of this experience because of the way that it's making them feel.
Mm-hmm. Yeah, and mothers create the next generation, right? So they're the future, and so I think mothers with great health is what our world really needs.
Yes, I totally agree.
Right? Okay, so what was the most difficult health change for you to make personally?
Yeah, so I think for me, back to what we were saying at the beginning of the podcast, I am a doer, a go-getter. I'm very curious. I like to do a lot of things. And so to hone back that aspect of my energy, I'm very vata, so I give my energy out a lot. And so to hone back the social slice of my life pie and the doing things slice of my life pie, and just give myself grace that it doesn't all have to happen right now, and to hone that time back so that I can just rest and I can do more restorative things, because my energy is going out all the time. And so to bring it back in has been the biggest health change that I've made. It's, more than any kind of diet or supplement or anything like that I've made. But if I can just sit in silence, if I do something like meditate, I mean, it elevates me to a whole new level of vitality. It's just very difficult because it goes totally against the grain of my personality type.
Yeah, definitely. So what would you say that's something that you're still working on, or?
Yeah, I would say that. So and where this bleeds into me is like with exercise, because the kind of exercise that I'm most benefited from is something like yoga, like a yin or slow yoga. And that's really difficult to do when your mind is racing and you want to be, whatever. And because I give so much energy out. Yeah, exactly. It's very vata. Yeah. Because I do give so much energy out, I do fear like going on runs and that kind of thing, that it's so much energetic output because I have sort of a finite amount throughout the day, right? And so the things that do bring me more energy are things like yoga. It's just more of the compliance for me, is finding the time and space and then being like, no, I'm going to do this. I will feel better afterwards. So that's always my uphill battle in my mind.
Great. And then the last thing is, if you could have a commercial, what would it be about and why?
If I had a commercial, I would make some sort of like funny yet also serious, with a serious undertone commercial about, sorry, hold on. No worries. About using a doula in birth and hiring a doula, and it being like such a game changer, because how are two people who've never given birth supposed to just figure this out with no support?
Definitely. Okay. Well, great. Thank you so much. I'm sorry, the lawnmower just came in at the very last.
This is real life.
Yeah, exactly. Real life. Well, thank you so much for joining me on the show. I really appreciate you coming, and I will see you next time. So we'll hopefully have you again.
I would love to come back.
Yes. Thank you.
Thanks.
I hope you all enjoyed that episode and now have a better understanding of how important it is to have a postpartum plan along with your preconception plan. Make sure you check out Dr. MacDermott's social media pages for great tips on the whole process of childbirth. She's a wealth of knowledge and super fun to follow, so passionate about what she does, and I just love following her, so make sure to check out her on all of the social media channels. I will have all of her information in the show notes below, so make sure to check that out. But alright, I wanted to remind you all that during this pandemic we are currently experiencing, there are so many mothers still giving birth, so let's keep them in mind while making conscious, responsible decisions to help support them and their children. That is all I have for you all today. I'm wishing you all Mahan or great health, as I always do, but a little extra right now. And as I stated in the beginning, I am here to support you if you would like someone to talk to during this time. Please reach out to me on social media if you're feeling afraid, alone, or anxious. I'm going to be right here with you throughout this entire process, and I do think that we will all come out stronger when this is over. But alright, here's to us working together through technology, and I will see you next time.